All right. Hello, everyone. I am so excited to be sitting here today with Dr. Jason Abaza. He is a red light therapy expert and has been working with clients for a number of years, treating them with red light therapy and helping them to achieve some health goals that you really would not expect. So I'm excited to sit down. He can share a bit of his knowledge, his expertise, and his experience with all of us. So thank you so much for joining us here today, taking time out of your busy schedule, Doc.
Of course, I am honored to be on here with you guys today. I'm always excited about talking about red light therapy, so hopefully I can share a few extremely valuable nuggets with your patient base and help them improve their health and their longevity.
Awesome. So let's get right into it then. We can just start with an overall view of red light therapy, what it is. There are so many things that red light therapy can be beneficial for, whether that's skin conditions or weight loss or overall metabolic health. Can you give us a little bit of a rundown of what red light therapy is and how it can help our practice members?
Herein lies the struggle with red light therapy. A simple Google search will yield so much, but the struggle is that because it does so much, it sounds too good to be true. It sounds like a magic pill, right? And that puts up a wall for people, myself included. When I first got into red light therapy, my number one prevailing emotion was skepticism. What I would encourage all of your patients to do, simply, guys, go onto Google, type in red light therapy, or you can type in photobiomodulation. You can use Google, you can use YouTube, you can use Google Scholar, you can use PubMed. There is so much out there. Here's the caveat. Red light therapy does everything that you're going to read about. It's not a magic pill, though. It takes time and repetition and consistency. And the best analogy I can give you guys would be it's just like going to the gym and exercising. There are phenomenal benefits to doing that. But if you're expecting to go to the gym and do one 45-minute workout and magically expect to see your body change overnight, we know that's not the reality. We know it takes going multiple times a week for weeks or months or years on end to see those huge changes. But simply put, red light therapy, while people typically tend to use it to change their aesthetic on the outside, to decrease wrinkles, remove fine lines, regrow hair, reduce body fat, really it's working with the body at a cellular level. It affects your cells. Our body is made up of trillions of cells. And the cells are like the building blocks, right? They control how our body feels and how our body functions. And every second of every day, your body is replicating cells, either healthy cells or unhealthy cells. There's no in between. It's one or the other. So the question is, what do you want, obviously, for yourself and your kids, the rest of your family? You want your body to be building healthy cells. Red light therapy, in my humble opinion, is the absolute best modality out there to change the function and the health of your cells. Why? The cells themselves have something called a mitochondria. The mitochondria is like the powerhouse of the cell. It's the energy producer of the cell. And when the cell and the mitochondria is exposed to certain wavelengths of red light, and this is not UV light we're talking about. Red light therapy is not about UV light. It's not a tanning bed. But when the cell is exposed to the light, it produces up to 200% more energy. And then the question is this, Doc. What could a singular cell do better with 200% more energy? Well, the answer is it would do everything better. And then you multiply that by the trillions of cells throughout the entire body. This is why I view red light therapy as an anti-aging device. Not because it makes you look younger on the outside, which it does, but on the inside, it's forcing your cells to function like they did when you were 16, 17, 18 years old. When you recovered quickly, you looked your best, you could play sports on the weekend, and an hour later, you feel totally normal. Your digestion is good. You have high energy. You don't have the aches and pains. This is what red light does.
It's amazing. And I'm so glad you brought that up about UV therapy because once you start making a lot of these claims, people not only are going to question the efficacy, but they're also going to question the safety. And
Mhm.
one thing that I have seen a lot of questions about is actually eye protection because while it does look very similar to a tanning bed, like you mentioned, it's really not. You're not having the UV exposure that you would expect with this bright light. So, is eye protection necessary? Because in my research, I've also seen that red light therapy is incredibly beneficial for eye health. So, can you talk to that a little bit?
Yeah, so if you look into any of the manufacturers of the equipment themselves, and this is just being very straightforward, guys, they put that on there. They want you to wear eye protection simply to decrease liability. It's a liability issue, it's not a health issue. Because here's what the science says. The science says that our eyes have a tremendous amount of cells within them. And what the research actually shows is that in people over the age of 40. Red light therapy helps reverse age-related eye conditions, which is huge. That doesn't mean you need to sit there with your eyes open. You can simply just close your eyes, and the red light is still going to penetrate past the skin on the eyelids. So if you were a friend or a family member of mine, especially over the age of 40, I would tell you don't block your eyes from receiving the benefits of the red light.
That's amazing because, I mean, myself personally, I've had eye problems my entire life. I got my first pair of glasses in first grade. And since then, I've had LASIK, but the benefits of that do wear off over time. So I'm very excited to be able to take care of my eyes in a way that I wasn't expecting to be able to do for myself. People just assume as you age, your eyes go, and it is what it is. So it's exciting to be able to offer this to people. But one thing that I've really seen quite a bit on, and you touched on this just a little bit, is red light therapy tied to weight loss. And now, weight loss is something that unfortunately a lot of people struggle with. So, can you speak to a little bit of the efficacy and how that actually works and how red light therapy can work towards the goal of achieving a healthy weight naturally?
I'll answer this by sharing a story with you guys. When I first got into red light therapy, one of my number one skepticisms was behind red light therapy helping people lose weight. So here's what I did. I invested into a really expensive piece of technology for red light. I brought it in, and before I offered it to my patients, I brought my brother into the clinic. My brother has his own set of struggles with weight. So what we did is we took a set of 20 different measurements throughout his neck, his upper belly, lower belly, legs, arms, everywhere. And I took those measurements multiple times over to make sure that they were accurate. He went into the bed, he did a 15-minute session, and then he went onto the vibration plate afterwards, and we can talk about why that's necessary. But when he was done with those two things, we post measured him. And in the 15 minutes, throughout his entire body, he lost 6.5 inches.
Wow.
And that was good enough for me to say, okay, this is really freaking cool. And I think a lot of people would be interested in it, right? And to this day, in my own clinic, um, the weight loss setting on the red light therapy equipment, it's the most popular reason someone comes in to use the bed. It's the most popular modality. We've built an entire weight loss program around it. The science behind it is this. When you're laying in the bed, if you're using the right wavelength of red light, it's going to penetrate inches deep past the skin to reach the fat cell. And the fat cells, they're like little globes. The red light is going to poke little holes in the fat cell, and everything inside of the fat cell, which are the fatty acids and the toxins, everything's going to leak out. So the red light is not destroying the fat cell. It's not getting rid of it. It's simply changing the shape by shrinking it. It's changing it from a grape down to a pancake to create measurable changes. It's not water weight. It's not inflammation, and it's sustainable. And then the number one question that I get is this: are there side effects? No. There's no burning, there's no itching, there's no scarring. It's strictly affecting the fatty tissue, not the muscle, not the bone. And then the follow-up question on top of that is, well, doc, that sounds great, but is it going to come back? And I'm going to be very forward with you guys. There's no such thing as permanent fat loss.
Right.
including but not limited even to liposuction. You can go get a very invasive procedure like liposuction right now if you
Mhm.
don't change your lifestyle, the way you're eating, eventually the weight will come back, right? So, and I know you're going to do this, Dr. Kristen, but the way you want to do this to actually see the long-term changes and keep them, you use the red light with the vibration plate, and then you give proper healthy eating guidelines to help people keep that weight off. It's as simple as that.
Right. Amazing. I know everybody's looking for the magic pill, and a lot of times it is that lifestyle change, and this is just there to help catapult us into
Yes.
that healthier lifestyle. It's not a cure-all. You still have to do a little bit of the work, but it's going to help you reach those goals faster, and that's the really exciting part. Now, one thing that I've been hearing a lot of as we've been exploring this, and maybe it's just the algorithm has tagged me in it now, but it doesn't seem like I can open social media without seeing somebody with a glowing mask on. This it can almost be tagged as a fad, or it's just the new thing. But this is really something that's been around for decades. But now that it is getting that social construct around it, there's a lot of home devices that are coming about. So why would somebody choose a medical grade pod over something that they can utilize at home, some of these at-home devices?
It's a great question. And you're right. Red light therapy, the origination of it actually came from NASA almost 40 years ago now. So it's not new, it's just gaining traction now. And I think that's due in large part to the longevity industry. It's a $33 trillion industry, and not for nothing, I'm not against it. I think the average American right now is recognizing the fact that if I want to live longer and live healthier for longer, there are things that I need to do outside of my typical once a year doctor's visit. And red light therapy is one of those very popular and effective things. So your question was, why full body over a device? Well, we can keep it simple or we can go more into the science, but on a simple level, I would say when you're using red light therapy like a face mask or a cap or a panel, you're really limiting the exposure that your body gets. And Doc, I think you and I see this the same way, but it's something we try and teach our patients. The body, yes, it's individual pieces, but it functions as a whole. Everything is connected and everything works together. So in the ideal scenario, whatever therapy we're using it on the whole body at one time because the body is a whole body mechanism. Everything's connected, works together, and heals together and functions together. Ultimately, when it comes down to the outcomes, the clinical outcomes that somebody would see when they use red light therapy, the number of lights that a piece of equipment has, the strength of the lights, and the proximity of the lights to the body. Those are the three things that we look at. And when we look at those three things, of course, a full body medical grade bed with 30,000 lights is going to produce a significantly different outcome than a face mask with 24 LEDs on it.
Right, amazing. Thank you for sharing that because it's a huge growing field, and I'm glad that it's finally getting the attention that it really deserves. But of course, that's going to come with a variation in efficacy and product types and cost and all of that. But on that note, this is something because it has gained more traction, is a lot of professional athletes are adding this into their recovery regimen because obviously they're pushing their bodies to the absolute max. And while we see more of what we lovingly call our occupational athletes or our weekend warriors, this is something that's going to do the same thing for them, where they're going to see the same benefits that a professional athlete would have when they are pushing their bodies to the limit. So, can you maybe speak to some of the professional athletes and sports teams that are utilizing this for their athletes to help them reach that next level in their training?
Almost all of them. Almost every MLB, NFL, NBA team has a full body medical grade bed, multiple of them in their training facility, and the players are using it pre-practice, post-practice, pre-game, post game. If it's good enough for a professional athlete, my thinking is we should start incorporating a lot of what they do into our own regiments. Um, the UFC is using it now too at their Performance Institute. But the question I think is, okay, why are the athletes using it? It's because of the effects it produces for them. They are recovering faster. They have less pain. They have less inflammation. They're increasing their muscle growth. They're increasing testosterone. These are, again, how is all of this stuff happening? It's all because the red light is triggering the cell to produce more cellular energy. You're creating superhuman cells within your body that can perform much better, probably than they are right now, guys. As we age, a natural part of aging is that our cellular energy naturally declines. This begins to happen around the age of 35 and just keeps going down as we age. This is why we wake up, we feel stiffer, we're in more pain. You probably notice it takes a lot longer to recover, even from a simple paper cut, than it did when you were 20 years old. So that's the science behind it.
Yeah, it's amazing. And in the world of where everybody just wants that little bit of an edge, it seems like this is something that, if it's like you said, if it's good enough for a professional athlete, it's good enough for us. And while I'm not trying to hit home runs, that's never going to happen. Being able to get off the floor a little easier after playing with my kids or roll out of bed a little bit more energetic, that's what I'm after as well, as we all, we're all aging. None of us are getting away from it, but what we can do to assist ourselves in that. So, to wrap this up here, to respect your time here today, Doc, um, we kind of spoke a little bit about the efficacy of it, but there's always going to be skeptics. So, when we're making these big claims, what's something that you would love to just leave our skeptics with? Somebody that's like, yeah, I'm still not bought in. I don't understand it. What would you say to them?
I would say I understand because I was in the same position. I was super skeptical about it, right? Like, can we be honest when we're making these investments into our clinics to provide our own patients who know and trust us with their health and their family's health over decades? We're going to be skeptical. We're going to do a lot of research to protect our businesses and to protect our patients. You can easily overcome that skepticism just by doing a bit of research. It's not hard to find this stuff. Red light therapy has tens of thousands of peer-reviewed pieces of literature out there. So use Google Scholar, use PubMed, use YouTube. These case studies, these clinical studies, they matter, and you can find people who have used red light therapy and have seen tremendous results. I'll just throw one caveat on that though. Don't go into this if you're going to use Dr. Kristen's equipment. Don't go into this expecting to have a miracle after one session. Now, I've seen that happen, especially with neurologically impacted patients with like neuropathy and multiple sclerosis. Those people see a night and day improvement very quick. But for the average person, coming 2 times a week for about a month is when they're really going to start to notice the changes in their weight, the way their clothing's fitting them, hair follicle growth, their pain coming down, their energy, their mood, their digestion. Give it time. I know we live in a quick fix society right now. This is not Amazon Prime. We're not guaranteeing delivery in 2 days, right? And I think people need a reminder of that because everybody is just trying to sell and push quick fix. And that's just not the reality of health, nor will it ever be.
Right. Thank you so much for pointing that out. That's always something that we try to enforce on our chiropractic side of, some people walk out after one adjustment and they feel like $1 million. It's not the norm, and it still takes that time and repetition to really see the results that people want. So, in that same philosophy and the same rule applies with red light therapy. So, on that note, I want to thank you so much, Dr. Abaza, for taking the time to sit down and share a bit of your expertise and your experience with all of our practice members. And as a reminder to all of our friends and family, for the month of April, and I'm going to have the details on the screen here, but we are doing complimentary consultations and mapping sessions with the friends and family of New Hope. This is normally going to be $150 once we open it to the public in May. So please make sure that you take advantage of this. Let's sit down. We can talk about your goals, figure out what wavelengths are going to be the best for you, the dosing, frequency, everything like that needs to be mapped out specifically for you and your goals. So take advantage of it. We can't wait to see you in the office. Thank you so much again for your time, Dr. Jason, and I look forward to talking to you again soon.
Have a beautiful day, everybody.